Now, Good Morning Maryland at 9.
Thanks for joining us this morning. Okay, if you've been out shoveling, you definitely have a workout. Your heart rate gets up, but you also have to be careful. That's something we want to talk about, your heart this morning. The experts say there's preventative things you can do, and Dr. Monica Aggarwal is here to tell us what to do. Thanks for coming in.
Sure.
Off the bat, let's talk really quickly about the shoveling, because so much of us are going to be doing it again. You really have to be careful.
Yeah, I mean, we have so much snow out there right now, 1 to 2 feet of snow, and you really have to keep in mind that it is a big workload on your heart. If you do have a heart condition, I don't recommend shoveling. Have some neighbors help you, get somebody to help you plow out, but really take it easy. If you feel like you're having trouble, working too hard, sweating too much, really step back, have somebody else do it, take a break.
You hear those stories every year, so it's a good thing to keep in mind.
Absolutely.
Let's talk a little bit about the preventative things that we can do. That's sort of what it's all about when it comes to heart health?
Sure. I mean, at the end of the day, we have to remember that heart disease part of it is fairly preventable, and I think it's important to remember that aside from your family history, most of our risk factors we can correct. American Heart Association and we as cardiologists are trying to emphasize that. What does that mean? So, well, so many things we can correct. What can we do? If you smoke, stop smoking. You have to stop smoking. It takes about a year to recover the detriment that you cause with smoking in terms of heart risk. The other thing you can do is start walking and exercising. Gosh, in this weather, we're all getting a little bit of cabin fever, but try to walk up the stairs, up and down the stairs. You need about 30 minutes of exercise 5 days a week. That's sort of a normal, everyday week. So if you're stuck in the house, try to get on a treadmill, go up and down stairs, whatever you can do. Of course, consult your physician if you have a medical problem.
Okay.
Other things to think about are your diet. In terms of diet, we really recommend people eat fish, heavy, fatty fish, 2 times per week, really cutting your calories. Portion size is key. Everybody says, I eat very well. Well, you have to really cut your portions and cut them in half. Our plates are bigger, we're eating bigger portions, and you get this impression that you're eating a normal size, but actually our plates have gotten bigger over time. So you really just need to start eating on appetizer plates and really cutting your portions in half, drinking more water to flush out the system. The other things that we should think about are, general things like blood pressure. A lot of people aren't getting their blood pressure screened. We should be screening people in their 30s and 20s and 30s. Blood pressure less than 120 over 80 is really important. A good blood sugar, less than 100, and working on
BMI, I know
BMI,
that was another
sure.
one that you said.
Yeah, body mass index is the biggest thing I think that we need to focus on. Obesity, ultimately, we all know America's getting fatter. We need to work on getting people healthier and eating less. So if you cut down your weight, then most of the medical problems that are associated with weight will also decrease.
And I think one other thing that was on the list was blood sugar, and for most of us, a lot of us don't have any idea what that is.
Sure.
How do you go about getting that tested, and how do you know what's healthy?
Sure, it's a good question. I mean, your blood sugar can be up and down, and you won't know it on a daily basis, and so these things have to be done by consulting a physician. I really recommend that in your 20s, everybody should see a physician to get their blood pressure checked, the blood sugar checked, your cholesterol as a baseline, to make sure that you aren't one of those people who have already a family history or a predisposition to high cholesterol or high sugars. Was
it a coincidence that number 1 on the list was quit smoking? Is that really the most important one to do?
Well, I mean, I think that I tell some of my patients that, many of the other risk factors that you might have, smoking really does damage the blood vessels directly, and any medication I give you, I can't counteract the effects that smoking has on your heart.
All right. We got to take care of your heart. Thank you so much for coming in, Doctor.
Sure, no problem.